All right, everybody. I have on Sydney Parlier, and I'm so excited to chat with her. You guys don't know this, but we've been trying to do this podcast for like 7 months. There's always been something
Yeah.
that has come up. So I'm really excited to connect. I connected with her in a doula community, and what really made me want to bring her on is that she talks about cannabis use in pregnancy and in motherhood. And I found this to be a super interesting topic. It's something that we've never chatted about on here. And I've also just had a lot of people in my life who have dealt with, or whether it's clients or friends, nausea and insomnia and not wanting to turn to pharmaceuticals and not knowing what is safe to consume and what does the research say? What do these things say? And trying to figure out what's best for them. And that's what we're all trying to do, right? Just trying to survive and like figure out what's best. So I'm really excited to dive into this topic. So thank you so much for coming on the podcast.
Yes, absolutely. And yes, we've been trying for so long. So I'm ecstatic that we finally got a date to work and that we're here chatting about this because, yeah, the topic is endless and it's so vast. And I'm just grateful that you're having me on your show to talk about it.
Yeah, so I would love to dive into because your whole thing, I mean, your name that you came up with, the Canna Birth, is awesome. How did you start that, and what made you want to start education for women on cannabis use in pregnancy and birth?
Yeah, so a lot of people don't realize this, but I actually started in the cannabis space before I became a birth worker. So I was writing freelance articles for an Australian telehealth clinic. And these were all articles like they were SEO based. So they were just like cannabis for depression, cannabis for headaches, cannabis for arthritis, cannabis for autism, cannabis for headaches, sleep, like all of the conditions, which are hundreds, that people use cannabis for. So I got really familiar with cannabis and cannabis research, realized then how much there was. There's so much research on cannabis. It's one of the most researched plants in the entire world. So when people say there's no research, that's just not true. There may not be research on cannabis and pregnancy specifically, but there is definitely research on cannabis. And so I got my cannabis consultant certificate and wasn't really sure what I was going to do with that. I really just wanted the knowledge. I've always been kind of drawn to service. And then when I discovered what a doula was, I was like, wow, I think I am a doula. I was actually looking for answers late in my last pregnancy, is how I came across it, and was just like, wow, I think I need a doula. And also, I think I am a doula.
Mm-hmm.
And so it was very intuitive for me to just combine those two things. I remember asking in my doula training, like, they were talking about other areas that people are experts in or other certifications that they have that they could like combine with their doula work. And I was like, hey, what about cannabis? This was a tool that I had used myself, that had been effective in my pregnancies. I really had no guidance on it, but I chose to do the research myself and like, what if I do this, And I remember my teacher, I guess, at the time telling me, I feel like if you don't combine those things, you're doing a disservice to your community. Like, if that's something that you're passionate about and you believe, um, or know that it helped you, like, talk about it, And that's essentially how I started doing it, was by just talking about it. I talked about it on social media. I found the Canna Mom community. I was working as a private practice doula, so I had a LLC. And when I figured out that I really wanted to go all in with the cannabis informed doula stuff, that's when I created Cannabirth. And so I decided to create Cannabirth, originally as an extension of my LLC, but it's now a not for profit in the state of Illinois. And that's just so that we can apply for grants and funding and solicit for donations so that we can create educational material on cannabis and maternal health. And we can hire other experts and physicians and practitioners that could come give their guidance, because this topic is too big for me. It's like I've been a one woman show, and it's just a huge topic for me to tackle. So I'm happy to have the help now for
Yeah,
sure.
that's so cool. Um, Fellow Illinois gal here, which is fun. We're just not close enough to each other to actually podcast in person.
Yeah.
Um, so when you were saying that, when you're talking about like how there is research on cannabis, just not cannabis in pregnancy
Hmm.
or whatever it is, it does make me just like think about just pregnancy in general, because it's technically like unethical to test on pregnant women or children, certain things. So this is a lot of the feedback that we're getting from providers. Like I did an amazing episode all about herbs in pregnancy with an herbalist, and doctors will say they're not safe for pregnancy because there's no testing on it. But there is testing, like, and there is research on certain things. And then there is your intuition, there is what you feel good about in your body. But then it's like the only alternative that we're being left with is pharmaceuticals. And how does
Hmm.
that feel to you? You know, like I'm somebody who I really try to avoid as many like pharmaceuticals as possible. And in my last couple of births, I have had to use Unisom. I get such bad insomnia in my first trimester to where like I don't sleep.
Yeah.
And uh thankfully I haven't had like terrible nausea really in my pregnancies, like just pretty mild and easy to deal with for like a couple weeks. But the insomnia in the first trimester, and I'm very, very sensitive to anything that I take. So even with the Unisom, I would have to like, I would break it in half and take like a half before I went to bed. And I didn't feel great about taking that, but I also didn't feel like I had a ton of other options. Like after talking to the
Yeah.
herbalist, I'm like, okay, I could do some like try California poppy or some other things, but I know a lot of people, these pharmaceuticals are certain grades too,
Hmm.
and you can't test necessarily for how safe they are in pregnancy either. So it's like, okay, this is based off of this,
Yeah.
information, but like how safe is it really? Like everything has a risk.
Yeah.
So that's like what sucks to like trying to find alternatives outside of the doctor just being like, okay, like take a Tylenol if you have a headache, do this, like you have insomnia, okay, you can do the Unisom, or you have nausea, we have Zofran. And it's like, okay, what else? Maybe these aren't sitting right with me. Maybe they don't even work for me. Maybe,
Yeah.
yeah, my intuition's saying something different. I don't know where else to turn. But your doctor's saying, do not do drugs, right? Don't do drugs when you're
Yeah.
pregnant, and don't take herbs. They're not tested safe. So I know like so many people listening, I'm sure their interest is very piqued as in like, wait, I can combine cannabis in pregnancy. I can combine it in motherhood. Like, what does that even look like? But
Yeah.
also a lot of people listening um, probably are on a similar page with me where like we try not to use pharmaceuticals when we don't have to.
Hmm.
But also I'm not like a casual weed smoker really.
Right.
So although I did tell my husband the other day, I'm like been so stressed out. I'm like, all I want to do is like maybe take a bath and like a hit.
Yeah.
But I'm co-sleeping with my baby. So for me, I also know how sensitive I am to
Right.
marijuana. So I wouldn't do that because he ends up in bed with us and I wouldn't want to ever like put myself in that situation.
Right.
So I'd love for you to just kind of take it from here. I know I just like spilled out a bunch of things. So I didn't necessarily ask specific questions, but you get what I'm laying down.
Yeah. Yeah, that's okay. I'll try to just start, and we'll go off on a tangent, I'm
Oh,
sure.
perfect.
Um, so let's kind of talk about because you touched on something that I think is important, which is like the reasons that someone might be consuming during pregnancy. We know these really common ones like nausea, vomiting, chronic pain, sometimes just for high stress. Like you said, you're so stressed out, you just want to like take a hit and just let your mind just like relax for a little bit. And whenever I get asked by a healthcare professional or provider, when I have the opportunity to speak with them, when they ask why someone might choose cannabis during pregnancy, I'm like, it's probably because they were already using it for something and it was working for them in some way as a tool or as an alternative medication, and they want to continue to do that. They want to continue to have that option. They don't want to have to switch to a pharmaceutical during pregnancy because, like you said, we also don't really know the full scope of all the risks of that. And cannabis is not risk free. There's risk in everything. And so, yeah, it's always kind of an interesting question when we talk about why someone might consume. There's hundreds, thousands of reasons. So, um, yeah, I'm like trying to think of where to even start with what you were saying.
Well, like, so like you said, there's so many different reasons that people would consume. Um, and a lot of times, like you said, it's somebody who maybe was doing it before. So like when they get pregnant and they're being told like, no, 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 no,
Yeah.
like how do you make that choice, I guess, like for yourself to like, is there a limit? Is it like, okay, I can do it, but way less to be safe, or like,
So,
how do I
so
do
I
it?
think, yeah. So I think as far as research goes, we kind of talked a tiny bit about how there's lots of research on cannabis, not a lot of research on cannabis and pregnancy. And the reality is that we'll probably never really have research on cannabis and pregnancy. We'll probably never really be able to look at a study and say, oh yeah, that was a really well built, flushed out, fair study on cannabis. It's just probably not going to happen. And you could say the same for any other herbs or pharmaceuticals, right?
Mhm.
So I think for me in my practice, I kind of focus on giving people other tools outside of the research and the evidence, to make that decision for themselves. So first, starting with their why. What is their motive? What are you really looking for? What's your goal? How are you trying to feel? What condition are you trying to treat? Get really clear on that before you consume, especially during pregnancy or when you're trying to conceive as well. We know that optimal chances of fertility happen when our endocannabinoid system is balanced. So we want to make sure that we're not over consuming. And then someone who maybe has an underactive endocannabinoid system also doesn't want to be under consuming either. Cannabis can be a tool for them to help balance their bodies. It's a tool for everyone to be able to balance their bodies. Some people just simply don't need it. Like you're someone who's really sensitive. I'm really sensitive. We discussed that a little bit before we started recording. I probably don't need that much. That's
Mhm.
just the reality for me. So I definitely have friends where they are high needs. They are treating PCOS, or they're dealing with breast cancer and chemotherapy, and they're using very high doses of THC and other cannabinoids to treat what they're treating. But not all of us need that. So when you're trying to conceive or you're pregnant, you definitely want to find that balance. And so that's why usually after I establish someone's motive, we talk about our endocannabinoid systems and try to find out like what they're doing for their bodies outside of cannabis first. I I don't think that cannabis should ever be used as a crutch, even outside of pregnancy, but especially during. It's like you said with nausea, there's things that you can do to remediate nausea and vomiting without using cannabis, but some people can't. So for some people, it's manageable, and if it is manageable, by all means, I think you should try to manage it on your own or using alternatives. But cannabis can be an alternative and a tool as well. So yeah.
Yeah, well, and I think that that's probably a lot of the stigma I'm sure that you probably get too, because like having the Cannabis logo, people are like, oh, this lady just wants to like be high throughout her pregnancy.
Yeah, and that's just simply not true. I actually in my last fertility journey or trying to conceive journey, I quit completely because I really wasn't consuming that much THC anyway. I'm a pretty like moderate to light consumer, so I decided like, hey, let me just cut it out completely. And it really was fine for me. I
Mhm.
definitely advocate for people to make the decision that's best for them, and that the really cool thing about cannabis is that it's so versatile, and you can like change up what you're using and how you're using it and what kind of cannabinoids you're using for different seasons of your life. So just because right now it's not something that works for you doesn't mean in 6 months or 6 years it won't be something that works for you. Maybe it is working for you now. Maybe you're consuming more THC than you normally do because it's a high stress point in your life or something, but in 6 months it won't be. That's why it's like really important to be in touch with our bodies and know really what our homeostasis or what our balance looks like first before we rely on anything that's mind altering or alters our body in any way. So
Mm-hmm. Well, like you said, like how we kind of talked about how we're both sensitive, which is like why I wouldn't do anything now. Like it's been a very long time since it's been years since I've consumed any sort of cannabis. And I've always been like super lightweight. So like I feel like for me where I'm at right now, it'd just be like a distressor, but because of like co-sleeping and I know how sensitive I am and I wouldn't know how to like dose properly just to maybe be a little bit less stressed for a little bit, that
yeah,
like I couldn't do it right now.
yeah,
But I I know like a lot of people who throughout their pregnancies can't keep anything down and are extremely sick. Maybe they're not to the hyperemesis level, but like when they do eat, they do throw up and they are having a really hard time. Um, they can't even take their prenatals. As soon as they swallow them,
yeah.
they come back up.
That was yeah, that was me.
Yeah. Oh, that sucks.
Yeah, that was me in all of my pregnancies. So the first one was definitely the worst. It was awful. I really thought I was like dying. I thought, how am I going to like continue this pregnancy if I'm only drinking Coca-Cola? That was the only
Right.
thing that would settle in my stomach. I couldn't take a vitamin, I couldn't barely eat. So when I was like 12 weeks, I finally decided to smoke because I was so sick and tired of feeling sick and tired. And I just thought, I had been a cannabis consumer before. So I knew that it was used for nausea, and it worked. I ate a full meal. And pretty much from that point on, I was like, okay, I'm like, if I can nourish my body and feel better, then why am I like worried about all these conflicting, all this conflicting information that I'm finding? Because the more conflicting information there is, the more to me that it seems like there's just no answer. It doesn't tell me yes or no. It just tells me that like they just can't get on the same page.
Mhm.
Providers, practitioners, pharmaceutical companies, they can't get on the same page about what they actually think about cannabis. And that's why we have so many legislation issues as well. We have medical cannabis, recreational cannabis. Now we have hemp derived cannabinoids, and people are creating products from hemp, but they're actually THC products. And it's like, it's messy. It's super messy because it's such a highly variable plant. And with that being said, like, it also has other components. There's other cannabinoids you could use. So for your case, like if you're worried about co-sleeping, you could try CBN, which is a different cannabinoid that is known to cause sleepiness. But it wouldn't have the same psychoactive effect as THC. It would just be like more on your body.
Mm.
As far as co-sleeping, we can talk a little bit about co-sleeping because that's definitely a concern of a lot of new moms,
Yeah.
especially those that are breastfeeding and they're just like co-sleeping all night. I would say that if you are not normally a light sleeper, if you're someone who tends to fall into a deep sleep, like maybe you're having trouble sleeping right now, but when you do fall asleep, it's a deep sleep. I would suggest taking all of the safety measures for co-sleeping. Maybe even making sure that there's, a barrier between you and baby, that, they have those things that lay on your mattress that kind of like keep baby surrounded. That might be an option. But for me personally, I am a very light sleeper. So it never really affected me like that. Like I would take 5 milligrams around 5 o'clock at night. And by the time I would go to bed, and this is like with a newborn. So bed was really not like, there was no going to bed. It was just like we headed to the bedroom at, 10:30, 11 o'clock at night to begin the nighttime. By that point, it wasn't, my body was not still like actively feeling the effects of the cannabis. It would help me fall asleep initially, but it wouldn't like keep me asleep all night where I like couldn't wake up when, he was moving or something.
Mm-hmm.
But I'm also a very light sleeper. So, it's like so variable person to person for sure.
Yeah, totally. It's funny we're talking about this today because I've just been so exhausted lately. And like I was telling my husband like recently just how stressed out I've been. Not even just like that motherhood is hard because it definitely is. Like I have a 3-year-old, a 2-year-old, and a 4-month-old. So like I'm in the throes of it all.
Yeah.
But what the stress on my body that I feel is the lack of sleep. It's the not being able to find time to move my body the way that it's craving to be moved. Like the stress isn't like, holy crap, like 3 kids is a lot because there is that aspect, yes, but like it's just the stress on my body from not sleeping. And normally when we put the girls down to sleep, either my husband will lay with them for a little bit or I will. He always passes out. Like he works construction and
Yeah.
he hits the mattress and he could literally hit the mattress. And there's been times where I'm like, I say something and I'm like, you just had your eyes open. I know you can hear me. And he's like out. And I'm like,
Yeah.
okay.
Yeah.
And I fall asleep pretty quickly too, like usually within 10 minutes, but definitely not like my husband. But last night I went to go lay with our daughter and it was like 8 o'clock and I passed out. And my husband said he came to wake me up and like a couple hours later and I was like face down. I'm not a belly sleeper. I was on my
Yeah.
belly face down and he was like nudging me hard and so then he's like shaking. He's like, is she okay? Like out. And so I'm like at that level of like tired to where,
Exhaustion.
right. But when I do sleep with the baby, I do feel him. But because of like where I'm at, again, like I wouldn't feel comfortable using it if I
Yeah.
was about to go to bed. Um,
You could also too, like you could also, if you could find a time, maybe on a weekend or something where your husband is home, where like you could actually get a nap or something, you could inhale instead of taking an edible. And that's kind of a shorter shelf life. So it's not going to stay in your system as long. Or I guess it's going to stay in your system, but you're not going to feel the effects for longer than 4 to 6 hours if you take like one hit off of something. And that's like max.
yeah.
And you could, and that would like maybe enable you to get like a nice solid nap during the day where it might allow your body to catch up. And then alternatively, like the cool thing about cannabis is that you can have cannabis that helps you sleep and you have cannabis that helps you wake up. And we also have cannabis topicals for sore bodies. You're really feeling that exhaustion in your body. It might be worthwhile to find like CBD cream with some magnesium in it and just like lathering your body down or giving yourself some self massage with it or something might just help you relax and get into a sleep that's not going to affect, like if you're going to pass out hard, you're going to pass out hard. But a topical cream wouldn't put you in any deeper sleep. It would just kind of put you in a more content state.
Mm-hmm.
So
Yeah. So like
yeah.
you're saying there's different uses. So like,
Mm-hmm.
let's say for managing stress, like during the day and like when I'm up, one of my kids has been waking up at like 5:36 every day, which is just too early for me. I'm not a five, anything before 7 is just so early.
Yeah. Same.
Like,
That's why I always co-slept because I'm
yeah.
like, please just sleep with me.
Oh my gosh, just let's cuddle for at least like we could like right. My daughter was up at like 5:36 today, but we stayed in bed until 7.
Yeah. Yeah.
Um, well, everybody ended up in my bed. So it was me and 3 kids because my husband had left for work. So it's just all of us in bed. I'm like, nobody move, just
Yep. Yep.
just stay a little
Yeah.
bit longer.
I'm the
Um,
same way.
so like, but once I'm up, it's you just have to function for the day, right? Like
Mhm.
have to keep going until it's time to put the kids at night. So is there, I guess, a way to use it to like manage that stress during the day to where, because there are the stigmas of like, if you smoke or consume, then you're just like, I can't, you get the munchies and you're just watching TV, right? Like that's all you're doing. So is there a way
Yeah.
to like, I don't know if it's microdosing or just certain strands to like mitigate stress, keep you going and you're fine. You're not like, because my experience, like I said, I'm just like super sensitive. So I guess the only time, like, not the only time, but in my later years, the only time I ever consumed was for sleep. So it
Yeah.
wasn't to like function.
Manage stress.
Yeah.
Yeah. And I have two younger kids too. They're 3 and 5. So I'm in the throes of it as well. And for people like us, it's like, it is like as soon as you get up in the morning, it is just nonstop until you go to bed. And maybe it's going to be that way for like years to come. But I
Forever.
do think, but I do think that these years are like feel a little more chaotic for us because we have so much to manage. I mean, these are people that can't get themselves dressed, they can't get themselves meals, they can't, so we do all of that stuff. So microdosing is a really effective tool for people like us that have to just be present all the time and don't want to not be present. I don't know a lot of moms in the Canna Mom community that just want to like smoke weed and be high around their kids all day.
Yeah.
I'm sure that people out there like that exist. I mean,
Mm-hmm.
nothing shocks me anymore, but on the majority and the people in my community, the people in communities right around are not really like that. Most of the time when they're coming to Cannabis, when they're coming to other platforms, like they're looking for tools to be a more mindful consumer and be more present with their kids to make sure that cannabis is not taking them away from parenting. Because for a lot of us, cannabis is a tool to tune in. It's not a tool to tune out. For
Mm-hmm.
me, I am a disassociator. So if I am really overwhelmed, if it's a really high stress day, like I can just like tend to check out a little bit, like where I'm just not, I don't want to play. I'm not into it. I'm not trying to hear about what you're doing. Like, mom, 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 mom. It becomes very monotonous, almost like the Charlie Brown, like womp, womp, womp in my brain. And that does not feel good as a parent. It does not feel good as a mom because at the end of the day, all you do is think about the day and how like, oh, I shouldn't have like lost my temper that easy. I shouldn't have been that disassociated, which we shouldn't stress ourselves out. We need to have grace for ourselves. But for me, cannabis is a tool that can like take me out of that. Like if I consume during the day, even if it's just microdosing, taking a 2.5 to 5 milligram edible or something, I can kind of come back to my own body first, and then I can re-engage with my kids. And it's like I can sit down and play. I then have like the bandwidth to be able to like manage the things and not multitask as much because we are always multitasking and it is
Mm-hmm.
not really our friend.
No,
So,
multitasking for me is like just doing a lot of things not very well.
yes,
That's like how
that's
my
exactly what it
multitasking.
is.
Yeah. I'm like, if I
It
could
is.
just complete one task and then move on to the next, it'd be so much like
Yeah.
better than if
Yeah.
I was like, da, 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 da. So it's
Yeah.
like,
And you actually get, when you single task, you get things done quicker, more effectively. You can set up systems to make things easier for yourself in the future. But when we're multitasking, it's almost just like this constant game of whack-a-mole.
mm-hmm.
We're just like constantly trying to like come up for air and come up for air. And there's this pile of laundry and we need to cook this meal and our kids are outside. So we need to check, it's like all these things. Cannabis has always in motherhood helped me to single task because it like almost makes you do that.
Yeah, yeah.
So you can't, I mean, I'm sure that people can multitask on cannabis, but I'm not really one of those people. And that's actually one of the perks for me. It's one of the pros. So
Yeah, yeah,
yeah.
I would like that. I'm like the queen of like unloading half the dishwasher and then like starting dinner
Yeah.
and then being like, oh, I need to rotate the laundry. Oh, I need to change a diaper. Oh, but now it's nap time. And then
Yeah.
later on being like, oh wait, I need to finish unloading the dishwasher. I need to
Yeah.
like, it's it's so much for me to get one thing done. Like
Yeah.
I don't know if it's just this mom brain
It's
or
the season. I think it's partially the season. We're not like in seasons right now where we complete things.
for
I can say I
real.
can say that as hard as I might try. Like if I do ever really feel caught up in my house, it doesn't last long. I
Right,
mean, we're talking hours maybe,
right,
and
right.
then it's over.
Yeah, it's a lot of
So
letting go. Like, okay, we're
yeah,
just not going to worry about this.
yeah, and that's the thing for me. That's what's so important for me to drive home in my work, and just when I'm like speaking about my story, is that cannabis has been a tool for me to like give myself compassion and grace in this journey. Not only does it help me connect with my kids, but it also just helps me see myself more gently than I used to. We can be really hard on ourselves in motherhood, that we're just not getting enough done. We're not doing enough. We're not enough for our kids. Like we got to heal and too. And it's been a tool for me that's completely invaluable. And it's a tool that I've been able to set down and pick up at different times in my life. It's not, I mean, it's almost always been constant in some form, um, but there's so many ways to use it. And so many times in my life that I've said, like, I don't really need this tool right now. Like, I'm good with what I have. And then there's other times where I'm like, oh, I have to rely on this tool a lot more right now because I just do. It's
hmm
okay. So,
Yeah. Um, what's interesting to me that I've actually like found for years. I remember I was, let's see, 17 years ago in college. I did this class where, I don't know, it's a speech class in college where you had to do some comparison thing. And I wrote a paper on alcohol versus marijuana. And even though I've never been like a huge consumer, I just never understood how like alcohol is so acceptable and
mhm.
marijuana use or cannabis use is not. And I remember even like later in my 20s dating this guy who was a paramedic, and he and I like got into an argument about it once. And again, I wasn't smoking at the time, I wasn't even consuming at the time. Um, and he was just like, no, it's a drug, and going hardcore. And then finally, like something connected. And he goes, you know what? I will tell you something. He goes, I've never been on a call for a domestic abuse case that was because of marijuana use. It's always alcohol. And I'm like,
Mhm.
right. And like the drunk driver, like things that happen, the domestic violence, like it's usually always alcohol. It's not
Yeah.
cannabis use. And so it's
Yeah.
proven to be so much safer than alcohol on a lot of different levels. And even better for your body. I wouldn't say better for your body. It doesn't create the liver damage, the
Right.
other things that alcohol does. Um,
Right.
I mean, there's been other studies with brain health and alcohol and a lot of other things, but so I've always been a fan, I guess, more of that.
Yeah.
Um, and even now that it's becoming more legalized, like we live in Illinois, but it's still something that like with our parents, they're like, but it's a drug, and so it's like
Yeah.
hard for some people to like make that adjustment in their minds. Um, and we've had the arguments with our parents before, and it's like, yeah, you can say it's a drug, right? But so is caffeine, so is, anything that can create an altered state of mind.
Right.
Um, so it's just
Nobody wanted to acknowledge that back then, though.
right, right.
This seems like new information, but it's not new information. It's just that nobody really wanted to acknowledge that when they have 3 cups of coffee a day, that they're consuming a stimulant every
hmm
morning or every afternoon or whenever it is. It's still mind altering. It's still a drug. It still has the propensity to create dependence or addiction, just like anything else that's mind altering.
Right.
And I love that our generation seems to be more proactive in having these conversations, because it's like, you know, back at the beginning of our conversation, when we talked about how doctors and providers like don't want to do research on cannabis and pregnancy because it's not ethical. And it's like, but we have all this research on all these other drugs. Like, why was it ethical to do all of this research, but not on cannabis, when actually the anecdotal evidence and historically speaking, we should be doing the research. Like, we really should be prioritizing it at a day and age when alcohol and opiates are killing new moms. I mean, I just downloaded a report. So I'm in central Illinois, kind of a decent sized city, I guess. And I just downloaded a report from 2021 that was about mortality and morbidity rates, and 62% of all women who died in the first year died from drug overdose.
Hmm. Wow.
62%. That's a
Wow.
lot.
Mm-hmm.
That's like more than heart disease, for
Right.
us. And that's wild. And at a day and age when we have that, why would we not want to give someone a tool that could help them? I mean, there's research on cannabis and opiates and how people coming off of opiate addictions can use cannabis as a alternative to help them wean off, and even like use it continually in their lives, to help their bodies feel better. So it's like, why would we not look at this? Why are we not talking about this more? When this is like a crisis. To me,
Yeah.
62% is a crisis. And when you looked at, of course, they still screen for cannabis in the hospital. So they have like the whole drug panel on the report. And it says like, what these women died of, as far as drug overdose. And there's zero for
Right.
marijuana, because marijuana doesn't kill anyone. So it's like, why are we even screening for this at this point? Like, if you want to find out what moms are dying from when it comes to drug overdose, it's not cannabis, and it never will be cannabis. So
Right.
we need to look at some of these other things. I want to say fentanyl was the highest, which is not surprising, but
Right.
that's almost always in something else. So
Right. Right.
yeah, pretty
Mm-hmm.
disheartening.
That
Yeah.
is, yeah. And I mean, and that's also like a whole thing in itself, because you know that our country could be doing more to control the drug problem, and it's just not happening, the opioid
Not.
problem, and it's very, very messed up and upsetting.
It is. And even alcohol, I don't think that anything should be completely prohibited or illegal, but it's like totally, like you said, totally normalized to share 2 bottles of wine with, a couple of your girlfriends, and then get in your car and drive home with your kids. I mean, that's normal in my area. And
Mm-hmm.
it's like shocking, because it's like, that's acceptable.
Right.
But if I'm at a party and decide to socially take a puff off of a joint,
Right.
when I leave 3 hours later, it's like, oh, are you okay to drive?
Right.
It's like,
Right.
yeah,
Yeah.
you've been drinking. Actually, you're still drinking. So are you okay to drive?
You actually have wine in your
So
Yeti.
yeah,
So
right. Exactly.
yeah,
Exactly.
yeah, it is a lot. Well, and while I'm thinking about it, like most of the women that I know that consume it is for chronic pain, period pain, endometriosis, PCO, like it is for a lot of things like that. It's not, I mean, I'm in my later 30s. Like I don't know a lot of people that are like necessarily just trying to get high on
Yeah.
weed right now,
Stoners.
like,
You can say
or, yes,
it.
stoners. Um, but yeah, it's super interesting. I mean, yeah, there's a lot that goes into it. And I mean, there's, like you said at the beginning, there's risks to everything. There's pros and cons. And I think having like bodily awareness is like super important, and
Mhm.
knowing like, that there's different ways to consume or to do it, or different strains for different things. And I think that you also have to be knowledgeable on that, because you can't just like walk into a shop here and be like, oh, I'm going to try this for sleeping, because I don't know how that's going
Yeah.
to impact me.
Yeah. Yeah. Especially if you are a woman who is minding your menstrual cycle, you're trying to conceive, you are pregnant, you're breastfeeding, you're, anyone that's on that maternal health spectrum. Um, yeah, I would definitely suggest to seek out someone who has knowledge or tools or resources that can give you like solid information. Because if you just walk into your dispensary, even if you're in a recreationally legal state, your bud tender may not really know what your goals are. Like they may ask you, like, what are you trying to do? Are you trying to sleep? Are you trying to stay awake? Very basic questions. But they're not going to ask you about, your maternal health journey. That's just
Mm-hmm.
not a question that's going to come up. And it's important because cannabis can influence our hormones in certain ways. And we don't really understand how, but we know that it does. So to be able to be mindful about those things is a huge advantage for somebody who's choosing to consume.
I had no idea they were called bud tenders.
Yeah.
That's so funny. A bud tender. I love that. That's
Yeah.
hilarious.
Yeah.
Um, it shows you that I've never been to a shop here
Yeah.
before.
Yeah. Well, you
Um,
know what? Illinois is not the best place to buy weed in the dispensary either. So we can kind of touch on like sourcing cannabis because that's a thing for a lot of people is you assume you assume that you walk into your dispensary and you're getting a very clean and high quality product, and that's just not always the case. So
mm,
they do have like certificates of analysis that they're supposed to carry on every single product for every single batch. So usually there's like a little QR code on there. You can scan it and it'll pull up this certificate of analysis that'll tell you what the THC content is, if there's other cannabinoids, if there's pesticides, if there's heavy metals, things like that. So definitely important to look at if you are a health conscious person in or
yeah.
out of pregnancy.
Well,
So
just as you were talking about that, I'm like, oh wait, you probably have to like think about pesticides because especially since this industry is growing, I'm sure that
yeah,
they're just like trying to control
yeah,
it a little bit and spraying a bunch of pesticides on it, which you don't
yes.
necessarily want to be consuming those either.
Yes, cannabis plants are very finicky. For me, they are hard to grow, but because of that, when there's very large grows, they are using some of those pesticides that you don't even want on your food. And this is like something that's still being worked out in legislation for cannabis just across Illinois, across the entire country, is trying to regulate this because companies are getting away with putting some really gnarly stuff
Hmm.
in and on cannabis plants, whether it's in the soil to help them grow and help them get those nice big fat buds, or they're spraying pesticides all over their plants to help with pests.
Yeah.
But we definitely had a company here in Illinois, one of the multi-state operators who was just shut down for using a pesticide that was not legal. So
Oh,
it's like
geez.
it's happening still, and I'm sure even after they were investigated, I'm sure that the rest of their product was sold before they actually stopped. I like
Hmm.
find it hard to imagine that they actually pulled all their product from shelves.
Right.
So
Hmm.
definitely something to consider.
Yeah. I remember, so where I grew up in Nebraska, where my grandma lived, it grew rampant, wild there.
Yeah.
And then there were
Yeah.
like huge ones bigger than me. And I remember my uncle being like, it's not smokable. It's like, I don't know if it actually was or not, but they just like told everybody, like, it's ditchweed, it's not
Yeah.
smokable, you can't do anything with it. But every time we'd go there, we'd always find like the marijuana plants. And we'd think it was like so funny to like pick the leaves and,
Yeah.
do all
Yeah,
that
and
with it.
it probably wasn't. I mean, hemp grows all over the place. Um, it was a cash crop before it was illegal. So, I mean, really, for me, I think almost all of our answers that we're seeking in cannabis and maternal health, we can look to like history. We can
Hmm.
look to ancestral use. We can look to history, because it was being used to treat a myriad of things before it was made illegal. And actually, one of the first documented uses ever in the United States was for subinvolution. So it was helping the uterus shrink back down after childbirth.
Hmm.
So it's like, how is that one of the very first applied uses? And we don't, now it's like so far the opposite that we just like won't look at it at all. But
Right, right. I'd love to touch on breastfeeding and cannabis use.
yeah,
Like how much do you know, like how much gets into the milk? Is that affecting your baby? Because I remember somebody talking about that it could affect like your child's IQ if you're consuming a lot of
yeah.
cannabis. So I'd love for you to touch on that.
Yeah, so that's definitely one of the more like common things that you hear about cannabis research is that it would affect cognitive function. So even starting like in utero in the first trimester when the nervous system is developing, the brainstem is developing, that's when we want to be like really sensitive about cannabis use because we really just don't know the extent. But we do know to which it affects in utero, but we do know that from conception, basically, there are endocannabinoid receptors present in the fetus. So, with that in mind, it's like, well, then it makes sense. We don't know this for sure, but it makes sense that it would have the ability then to use those endocannabinoid receptors, right? So, we want to be definitely mindful, but that's one of the things that comes up over and over again in research. This research that does kind of come to this conclusion always kind of ends in the same way that there's really no conclusion that this seems to be what it points to, but there's really no solid conclusion and that we need more research. As far as breastfeeding, I wouldn't be any more or less concerned than I would be in pregnancy. I would kind of like with my clients, it's almost the same guidelines as it is during pregnancy, which is to know what your therapeutic dose is, know what the very minimum dose is that you're going to be able to use to treat or to achieve the feeling that you're trying to achieve. Not taking more than that and not taking less than that. And with breastfeeding, I always tell clients to, if they're concerned about it, to try to consume right after breastfeeding so that you kind of have like the longest window in between your next feeding session, which we know sometimes isn't that long.
Yeah.
It can be sometimes an hour, 2 hours, like when your baby's ready to eat again, they're ready to eat again. I definitely wouldn't like stave off a baby just because of that. I certainly know, and myself included, hundreds of moms that have consumed during breastfeeding in a mindful way. And their kids are, they don't have any, these kids are 6, 7, 8, 9, 10 years old now, and they don't seem to have any like cognitive lack. Um, but with that being said, one question that I always pose because we just don't really have the research on this is that if you are going to choose to keep consuming, are you willing to sit with yourself and accept the situation if something does come up later? Let's
Mhm.
say, that your child is diagnosed with autism when they're 5 years old or something. Are you going to be able to sit with yourself and say, like, it wasn't my fault?
Mhm.
I know that I did the best that I could. Or do you think you might have feelings of like, oh, I shouldn't have done that? Because if those are the feelings that are coming up, it's either like some shame you need to work through, or it's just your intuition telling you that like this is just not a tool that you need right now. I
Mhm.
firmly, firmly, firmly believe that our bodies tell us. And if you have those feelings that you're just like, oh, this just does not feel good for me, I'm just too worried about this to do it, then don't do it. But if you're somebody who is like, I'm really benefiting from this, or I think I really could benefit from this, let's say I'm on a pharmaceutical and I want to switch, but I'm breastfeeding, then I would say just making sure that you're consuming right after feeding to leave that nice long window. You can also consume other cannabinoids. Um, High quality cannabis is definitely like probably the most important thing in pregnancy and during breastfeeding. Really, anytime that baby is around you or in you, high quality cannabis is definitely important. And I would say always, but definitely in those times. So
Mhm.
breastfeeding is something that people always want to ask about and talk about. And there's no answer,
Yeah.
it really is just like really the work that you do with yourself and what you really think that you need. um as far as like amounts that pass through, there's been people that have like sent their breast milk in to get tested at cannabis testing facilities, and it's so low. It's like by the time it gets there, there's like nothing in it. So I think the one study that was done that was like somewhat haphazardly put together, it was like 0.04 nanograms or something like very, very minuscule, way less than alcohol would be after one drink.
Mm.
After 4 hours, it was completely gone. So
Mhm.
with that in mind, but with that being said, everyone's bioavailability is different. Some people have high and fast metabolisms where their bodies just process things faster. Some people have more fat in their breast milk. They have more fat in their body that's clinging on to that THC. So with that being said, I would just say, follow the same guidelines that you would in pregnancy, just being really mindful of consuming high quality cannabis. If you are feeding when your baby is little, step outside, wear a jacket, smoke particles cling to things. Like secondhand smoke is still a risk with cannabis, just like it is with cigarettes. So you want to take those same precautions, wash your hands. I even would if I would smoke, I would wash my hands and like wash my mouth area, brush my teeth real quick before I would even go back to my kids after stepping outside. So yeah, I
Yeah.
hope that helps.
Yeah, no, it definitely does. And also keeping in mind, because they're saying there's lack of research on cannabis use and breastfeeding, there's also lack of research in long-term effects of pharmaceuticals in breastfeeding
Yeah.
too.
Yeah.
So most of research that is done on any tests in babies or even things done in birth, it's a short-term test. We're not looking
Yeah.
at the long-term repercussions. We're not looking at
No.
okay, this happened in birth 5 years from now. What's happening with mom and baby?
Yeah.
So
Yeah.
that's how it is with pharmaceuticals too. So there's just a lack of research all around,
Yeah. Yeah.
which
So
can be
so
hard.
actually there's a study and it's put on by JAMA, which is
Mm-hmm.
yeah, I don't know what the acronym stands
I
for,
can't
but
remember but somebody that was just on my podcast, she talks about JAMA and we did.
referenced it. Yeah.
Yeah, because they did something on fluoride, so we were talking about that.
Oh, yeah.
I know
So
I'm
they
just gonna.
they have a study on cannabis and adolescence and cognitive function, and it is a long-term study where I think they started in utero for parents that were consuming and then followed them until they were 10 or 12. But the problem with that study is that excuse me, from the very beginning, it was completely self-reported. So
Hmm.
they didn't know what method these people were consuming. Were they taking edibles? Were they smoking? What kind of cannabis were they even using? Was it heavy THC? Was it a balance of CBD and they had no, it was just are you smoking right now? Or are you consuming right now? Or something like that. A very broad question. So it's we still don't even really have, that doesn't really give us any kind of information because we're missing so much context.
Right, a ton.
And they're starting to realize that now. I do think that we're going to start seeing studies that are better, that they're starting to take those things into consideration. Okay, wait a minute. So the method matters, the strain matters, where it was grown matters, how it was grown matters, what was used on it matters, how this person lives matters, where they live, what their state laws are, what their access is. All of these things matter, and they're starting to realize that. So I'm hoping that we'll see better studies, but like I said, I don't think we'll ever really see a completely fleshed out study on it because I just don't think, and I don't even know that we're really meant to.
Yeah,
Cannabis is a tool that is highly versatile. It's a plant. At the end of the day, it's a plant. So it just it's
yeah,
hard to research a plant, because
yeah.
especially when it can be applied so many different ways and can be turned into so many different products. Um, and with technology advancing as fast as it is, I just don't know that we'll ever really know. I think we have much more pressing issues, which are legislation and protecting people that are consuming medicinally. Because now we have providers, especially around this area, it's increasingly common for me to hear, oh, my doctor actually suggested THC for my nausea. So that's cool, but it's still they need the knowledge on it as
But
well.
how?
So
Right, right,
yeah,
exactly.
that's usually what it is they'll say, oh, I asked so and so about it and they said that it was fine, but they don't give them any guidelines about smoking risks or oh, maybe try an edible versus what you're doing, or maybe smoking is good for you because you're experiencing nausea and vomiting, so an edible is not really going to help you. So
Hmm.
Yeah,
Yeah,
lots
so
to consider.
interesting. I know. Before a couple things before we wrap up. The first one, can you explain quick, 'cause you said it a few times, something receptors. What was it? And
Oh,
like, what is that?
okay. So your endocannabinoid system,
Okay.
it lives in your body. It's
Hmm.
thought to be tied in with your central nervous system. So you have receptors all over your body. You have them in your reproductive organs. You have them on your liver. You have them around your heart, in your chest, on your lymph nodes. You have them in your brain or on your brain. You have them all the way down your arms. They're literally everywhere. If you Google endocannabinoid receptors, it should bring up a picture and there's dots all over the body to where they are. And these receptors are basically like if you picture a lock and a key system, these would be like the lock. And when you consume cannabis or you consume anything that has cannabinoids, because cannabis is not the only plant that has cannabinoids, it's just the one that has the highest. Um, it's basically like putting the key into that lock, and basically that's when the relief happens. So
Hmm.
as you ingest, let's say you're smoking, you ingest cannabis, it kind of like floods your body, goes into your body, and it kind of like all any empty receptors it's going to like plug into. And it can also flood your system a little bit too. So that's when people feel like that anxiety. They say, oh, I took like too much cannabis and I feel too anxious, or I feel
Mm-hmm.
too tired. That's like just too much in your body. Even though we can't die from cannabis, we can have overdose symptoms, which are like taking a high milligram edible when you have a really low tolerance, or your body just doesn't need that much, and you start having like heart palpitations and anxiety and things like that. All of those negative side effects associated with cannabis, those are actually overdose symptoms because your body just, it's an overdose.
Mm-hmm.
Overdose has such a stigma attached to it as well, but it really just is a dose that's just too much for your body. Um so yeah, I hope that's a good enough answer about what the endocannabinoid system is. So different
Yeah.
different cannabinoids connect with different receptors. CBD, which is like a popular product that most people are familiar with or feel a little better about taking, um those connect with more like inflammation, more things like in the body that can help with digestion and things like that. THC is more like nervous system related, so that's going to be like more of your brain. It's going to stimulate appetite, things like that. So
Hmm.
yeah.
Interesting. Cool.
Yeah.
Well, thank you for explaining that. And then the last thing
Yeah.
before you wrap up, will you just tell everybody how you work with clients one-on-one and what you have to offer?
Absolutely. So we're going to be starting up workshops for birth workers pretty soon. And these will just be like 2-hour sessions where you'll be able to come learn about clients consuming cannabis, how you can support them, have kind of that basic knowledge so that when someone comes to ask you about cannabis, you just have the answers. And then as far as moms who are consuming, we're starting a group coaching in June. So we'll be taking a cohort of no more probably than 15 people at a time, just so that they can get that one-on-one support. But it'll be 6 weeks where I'll walk them through my 5-step framework, which is basically a framework that gives them the tools to be able to decide if they want to consume, decide how they want to consume, and really get clear on their relationship with cannabis so that they can have a positive one. Because cannabis can definitely be something that can help us, and it can also hinder us, being that it is generally a mind altering substance. So I'm definitely excited for that, because I ran a group back in November, I think. And it was really cool watching them all like become friends, because they were all pregnant at the same time, all consuming, all in different places throughout the world. One of the coolest things about cannabis ever is that you can't like pick them out of a crowd.
Mm-hmm.
Everybody looks so different. It really draws people together from so many different walks of life. And especially for moms right now in this time of like, we're not as isolated as we were a couple years ago, but it's still like that for a lot of us, where we're just a little more isolated. We're living a little more of our lives online. It's nice to have a community of people that we can turn to and that we can talk to, because many moms that are consuming are not sharing this with their
Right.
provider. They're not sharing it with their friends and family. So they come and they're like, yes, I just want to talk about this.
Right.
So I'm happy to provide that space.
Hmm.
Definitely.
And like you said, you couldn't pick them out. And that just like made me think of like at becoming an adult, realizing that I know so many people that consume that I never would have thought did. I'm
Yeah.
like, wait, this person does? Like
People,
I never, like people in their 60s, 50s,
yeah.
60s, whatever. And I'm like, I would have zero idea that they
Yeah.
like to smoke. Like no
Yeah,
idea.
people say it about me all the time because I'm just this like Midwestern white girl, and I feel like I'll be at the park and like we'll be having conversation and be like, "Oh, you like smoke?" And I'm like, "If you only knew." If you're like surprised, if you're surprised to find out that I consume, like just wait until you find me on Instagram.
Right, 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 right. Not only do I consume, I also help women
Yeah,
all over the world consume
yeah.
consciously throughout their pregnancies. So,
Exactly. Yeah,
yeah.
exactly.
And then where can people find and follow you? And I'll include all the links in the show notes.
Yeah, you can find me primarily on Instagram at Cannabirth. And then I have a website, cannabirth.co. No
Perfect.
M.
Awesome. Perfect. Thank you so, so much, Sydney, for coming on the podcast. I loved having this conversation with you. I think that it's really important to give people options and to break
Yeah,
stigmas. And I think that, I mean, that's really like my goal in this podcast is to let people know what all of their options are and
yeah,
to start to learn to trust our intuitions and to um, know that there are alternatives to what maybe your doctor or your OB or somebody is just telling you. And you might not have to suffer with this thing, or you might not have
yeah.
to, you know, there is an alternative, I guess. So,
Yes.
yeah, I'm really glad that we finally got to have this conversation, and I'm really
Yeah.
excited for listeners to hear it. So thank you again for coming on.
Yes, no problem. Thank you for having me.